All right. Welcome, everyone. So glad to see you all here today. We are super excited to be putting this on with the help of our friends across the state. My name is Chris Riles. I am the anti-hunger advocate here at Tennessee Justice Center. And I've got a few other people from our agency here on the call. Notably, we've got our new WIC staff on board, Anna Grace Dobson, I'm sorry, Ann Dobson Ball and Anna Grace Breedlove. So if you will have their contact information at the end of the slides, if you'd like to reach out to them and talk more about how to do referrals and get connected. You will have all of our information, actually, and we will be sending these slides and a few other things out after the webinar. So yeah, glad to have you here. And we will go ahead and get started. So, like I said, this is our team. Signe Anderson is our senior director, and a few other folks. We are a growing team and glad to be so. Here's a little bit what we do as a department. Our goal is to end hunger in Tennessee by protecting and strengthening the federal nutrition programs. That's both in the state and across the country, but we work statewide in Tennessee. We look to improve access, remove barriers, advocate, educate. We like to think of ourselves as policy experts when we can. And we do a lot of direct client work, and that direct client work feeds our advocacy efforts. So that's kind of what we do in a nutshell. And then we'll just get right into it. So let's talk about child hunger and poverty. 18.1% of the children in Tennessee live in poverty, and this is a census data point, which is really important. That's a very high number. That equates to around almost 200,000 children in Tennessee, which is 1 in 8, and that's a very concerning number. And of course, there are a lot of ways to combat that, and WIC is one of the best ones. As far as WIC participation goes, in Tennessee, it is still a great number. 37% of eligible people in the state of Tennessee participate in WIC, and these are numbers from the National WIC Association. The good news, however, is that in the past year, we've seen a 15.1% increase in participation, which is a great number. And we hope to see that and much more in the coming years. Yeah, so a little bit about the WIC program, kind of generally. The full name is the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly referred to as WIC. It does a number of things. It's not just food support, it also is nutritional support, breastfeeding, all kinds of other services which really help people with children. There's a few things you need to know. The categories are pregnant, postpartum women, infants, children, and children up to age 5. So up to their 5th birthday, which is one thing that a lot of people don't know. To get WIC in Tennessee, you have to be a resident of Tennessee, and you just, it's whatever your local office is. WIC is great in that the income requirements are much higher than programs like SNAP, where SNAP is 130% of the federal poverty level. WIC is 185%, which surprisingly is, for a family of 4, that means if you make less than $55,500, you are eligible for WIC, income eligible at least, which is a lot higher than a lot of other programs. So that's a really good thing. Like I mentioned, WIC offers breastfeeding support. It offers formula for those who can't or don't want to breastfeed. It offers a bunch of different options like that. To use benefits here in Tennessee, there's a Tennessee WIC EBT card that you're issued, and it is used just like a debit card or other kinds of EBT, which is very helpful. And then the money is used for specific foods at authorized food retailers. You essentially, and some of our other speakers today will go into more detail, but specific foods get specific allocations of dollars, which help to support nutrition. These are just some of the things that are beneficial about the WIC program. This is not an exhaustive list by any means. But yeah, this is a good snapshot of kind of what the program is and why it's important. I'm going to talk now about the WIC Chow project. So the WIC Chow project is what is funding our work through this, and it is a nationwide initiative to increase WIC participation, funded by the USDA, and we are one of 36 projects across the United States that is participating in this. Our particular populations that we're focusing on are Black, Latino, immigrant, low English proficiency communities, and children ages 1 until their 5th birthday. These are the populations we've seen that need the most support in this and that are not participating as high levels as other populations. Another asset of this, another factor of this is to strengthen pediatric connections to WIC and WIC referrals, which is why you're all here today. We also are looking at the grocery store experience. We're looking to improve redemption, figure out, if people are on WIC but they're not spending their benefits all, why is that? Is it something to do with the grocery stores, and how can we support that? And then the last part of this is just general surveys and focus groups. We're working on research to figure out what are the barriers to accessing the program. If people are not participating and they're eligible, why aren't they? What are the issues that they're facing? So that's just a really broad overview of this really, really complicated project, but we're super hopeful that it's going to be effective, and we know it will be. These are just the goals, the large goals of the project, and I'm not going to read all this, but I will be sending the slides out afterwards, so feel free to do that. As far as WIC, you are all here today to talk about referrals. So let's talk about why it's important to refer to WIC. I think the biggest one is going to be credibility. As healthcare providers, you are credible, trusted sources of information for your patients, and so when you tell them a thing, they accept it, and so that can help to overcome a lot of stigma or maybe mistrust of government programs that some people might face, especially in some of these priority populations that we talked about. It is one of the most effective programs for combating hunger, just generally speaking. It's got a high success rate. The metrics bear out. It's great. It is a positive determinant of health. We always talk about kind of the social and political determinants of health when it comes to healthcare. This is one of the programs that is a positive determinant. It makes people's health better. It is a large part of the WIC program, and we are super happy that it is a factor. And lastly, a referral from a doctor helps to reduce medical fatigue. It's especially if you have young children or you're dealing with all the other things that come along with pregnancy, and this is one less thing that a person would have to deal with. So it's super helpful for physicians and healthcare providers to refer to the WIC program. This is a flyer that we've made. Feel free to print this off and keep it in your office or send it to your colleagues, or really, just use the information as needed. This is a flyer for providers to use, and these are actually links. So when we send these slides out, you'll be able to use these links to find information about this. And at the bottom here is I'm just going to do a shameless plug for our WIC Champions group. It's a monthly call that we do. We would love for you to join us. And now I'm going to hand this over to Dr. Hunter. Dr. Rosemary Hunter is a pediatrician at Vanderbilt, and she's going to tell us about her amazing work with WIC referrals. And I believe before that, we have a poll to do. So.
Yes. Hello, everyone. So glad to see you. We're going to start off. I just wanted to get a little poll of the room, the Zoom room as it is, to see sort of who is doing social needs screening. And then if you are currently doing any version of WIC referrals. So if you don't mind answering the poll here, that would be great. Just so we can kind of get a sense of what people's experience is.
All right, got some.
Ooh, we have a lot of experienced folks here. This is
Yeah.
great. All right.
And Rosemary, feel free to just let me know when you want to move forward.
Okay. Yay. All right, so in general, 80% of you are screening for social needs. That is great. That is wonderful. We have been doing food insecurity screening at the Vanderbilt Primary Care Clinic where I work since 2016, and we have only just this year increased and expanded to other social needs screening. So I feel your pain and how hard it is to get sometimes these things going and, developing a system to make this happen and meet patients' needs that we know impact their health. So that is great. I'm so happy. And then in terms of making referrals to WIC, you're kind of all across the board. So it sounds like some are doing more verbal encouragement. You can display WIC information, provide patients with WIC information, and even several of you, almost half, are doing direct referrals to the WIC program. So that is wonderful. So it's going to be a little bit like I'm preaching to the choir, but we will move ahead and I'll certainly share with what we're doing here at Vanderbilt. And then I hope that we can also maybe just troubleshoot and talk about strategies and ways that we might do that in the clinical setting. All right, so our clinic at the Vanderbilt Children's Hospital is a part of our residency training program. So it is a rather large clinic with lots of different providers, residents included. And I began, as I mentioned, doing food insecurity screening here in our clinic and establishing that program in 2016. So one of the things that came out of that was my desire to connect families and patients to a community food resource more directly. Because what we found is not everyone will admit to a need of food, but I knew based on national and statewide data that the need is out there, and we just needed to figure out a more direct link to get our patients to a food resource. And so our clinic we estimated about 6,000 patient visits a year in the WIC age eligible age group. So we knew we had a deep population potentially that we could impact. About 90% of our patients are on teen care. So we had, of course, patients and of course mothers who come in and bring their children, might also be breastfeeding. They might also be pregnant with their next child. So you have the ability in a pediatric clinic reaching out to some of the other populations. About 40% of our patients speak another language. And here in Nashville and Davidson County, if you work here, you know that Spanish and Arabic are the two other primary languages that are spoken. And so most of our materials are all translated in those two languages as well. So in 2021, I gathered together this task force to begin offering WIC referrals. So it took us a while to develop and figure out the best way to incorporate it into our clinic processes. We use a quality improvement approach to make that happen. I gathered interested parties from the nurses, the clinic leadership. We had some med students on the project. We had our community resource specialists, social work, and then of course WIC. We developed a strong connection to the Davidson County WIC program. Our clinic is lucky in that we do have community resource specialists, and I'm well aware that not everyone has this luxury. We currently have 2, and these are in addition to a lead social worker, a master's level social worker who deals with families with more urgent needs or also mental health needs and things like that. And what we found is that we use the community resource specialists to offer the WIC referral as a normal part of their workflow. So they were seeing all families routinely who were either new to our clinic, coming for the 2-month visit specifically, or if they screened positive for food insecurity when the patients were in clinic. These are the people that in person, the community resource specialist was going to see anyway. And then as part of that, she would screen if they were on the WIC program. And if they were not, she would offer them a referral to the WIC program. When we did this pilot and we were approaching our families, we also did some spot surveys of our clinic population, and we found out about between 50 and 60% of our patients were already connected to WIC, who were WIC age eligible, but that still leaves about half of them who were of age eligibility, but not connected to WIC. And about half of those that were approached for the referral did take her up on that and ask for the referral. Next slide. All right, so here is our X chart. Don't ask me, I had one of my colleagues help make this for me from our EPIC data, and about how we were making the referrals over time. So we start over here in November of 21, and then this goes here till mid-September. And it shows kind of the time points upon which we made different interventions to see if we could help increase our referrals. And so in general, we had, this is interval of every 2 weeks, we would have anywhere from, 2 to 10 every 2 weeks referrals going out. I think we averaged about 5 every 2 weeks. And then as you can see, some of the different interventions, we put posters about asking your provider about WIC enrollment in the exam rooms. We would train the community resource specialists on how to offer the referral and keep track of those and send them, of course. But every time one of the resource specialists moved on to a different role, we would have to train someone new. And so there's always a little bit of a learning curve, or we would see a decrease in referrals around holiday times, or things like this that would sort of impact those numbers. And then when we, at one point, we only had 1 resource specialist, and then we expanded and got 2. So anytime a little change like that happened, you'd see a small variation in how many we were able to do. However, our biggest change happened just this year in May, when we went to what we call at Vanderbilt the paperless initiative. And so when the families check into clinic at the front desk, they now get an iPad where a lot of the screening questions are done. So these are screening questions around the child's development. It also did social needs screening. So we now screen for, in addition to food insecurity, we now screen for, do they have a dental home? And do they have a car seat? And does their child wear a helmet? And so injury prevention screening. And then we also screen for other social needs like transportation barriers or housing instability or other financial strain. So when they come in and they answer these questions, it goes into the whiteboard, and then the community resource specialists can sort of flag and be notified when a family needs extra help. But one of the questions is also, are you on WIC? And they say yes, no, unsure. And the next question, if they say no or unsure, is, would you like a referral to WIC? And these questions are only offered, because of course computers can do everything, they're only offered to WIC age eligible families. And since most of our families are on TennCare, most of them would qualify by the income requirements as well. And so they can then electronically opt in. And this greatly increased the number of people we were able to reach, because we went from only having 2 workers in the clinic who were even offering the referral, going to the families were asked one question and then they could opt in if they wanted to. So this has been a huge boon into how many people we've been able to refer to WIC. It also has changed. Initially, our project targeted just Davidson County residents, but with the electronic system, and it captures everybody, we now have expanded and refer to other counties in addition to Davidson County. Next slide. All right, so here, our current numbers as of the end of August, we got these numbers just this week, were 436 families. And then we have gained approximately 100, we call it the spillover effect. These are siblings and mothers who were eligible for WIC, either due to pregnancy status or postpartum status, that were also gained into the WIC program. And then, so in general, early on, what we would see when we made these referrals, one of the nice early benefits was seeing that for every referral, we would gain about 1.3 people. So we would gain more than even those we had sent. And we meet regularly as a team. We have for the last couple of years, every month, to make sure that we're sending correct referrals and sort of refining our processes here in the clinic. And honestly, I could not have done this near as well as we have been able to do without the help of Lauren Cromer and Chloe. I think I saw Chloe was on this call earlier, but they have been very instrumental in helping this project to go forward. And then because of the electronic process that's now happened, we can roll it out to other clinics. So Vanderbilt has an association with clinics in Smyrna, as well as in Lebanon, as primary care clinics. And so we can now connect to those counties and refer those families to the WIC program. So it really helps broaden our reach by having a very standardized way of asking families if they want it. Next slide. All right, so as I mentioned, we did use the quality improvement approach in deciding who to include and how to get this going. If you've done quality improvement work in your training, you're usually familiar with how this works. But we help build support and awareness among our staff. When we would do surveys, we would build support and awareness for families as well. We were able to have a flyer that we had translated into our top 3 languages that we could share with families. So if you asked about WIC and they're like, what's WIC? We would have something we could share with them so that the families could be educated about it. We want to encourage, like, what could that look like in your scenario? So, first find out who your WIC liaison is in your county. Think about how to get in contact with them. Think about how can I connect with them better, and sort of put a face to a name for them as well as you. And then figure out the best way to sort of get a line of communication going so that you could send them the referrals. We'll talk a little bit more about that later. But figuring out what works and what didn't. So for example, we tried to put this in the nursing workflow. We tried to have it where the nurse would ask all the 2-year-olds at the 2-year-old visit, because this was a population we know is less involved with WIC than, let's say, the infants. And when we tried to do that, and of course, we're still in COVID times, what we found is that it did not flow well. There was not as much high uptake because they had so many other clinical duties, they would forget to ask the question. And when you just depend on 1 or 2 individuals, you'll have a higher risk of, your numbers not being as high, right? But 1 is better than none. So I do think that if what you can do in your clinic is more that one-on-one, asking if they want to be referred to WIC, that can still work. We can still send some referrals that way. But using the community resource specialists and putting it in their workflow worked better than trying the nurses. So sort of as one example there. All right, next slide. All right, this is a copy of the flyer that Davidson County WIC program made for us. They included their phone number. So if families had questions, you had something you could give them. They could go online and look at it. You can find that WIC screening tool on the WIC website. It talks about who's eligible. And it really just sort of helped give them information and a sort of a place, name, or website, to call. Next slide. And then in terms of what the referral process might look like in your setting. As I mentioned, this can vary a lot. So we use Epic is our EMR here at Vanderbilt. And we had a way and got our IT folks to help set up a way. So when our community resource specialists were initially making the referrals before we did the paperless initiative, we made it within about 2 clicks. They can make it in the communication tabs, and it faxed it directly to Davidson County WIC. And they had set up a phone number for that referral to go to. And then it went right there, and it was very easy for them to keep track and keep count of those referrals coming in. So having it be electronic and not require an individual to fax it, on their own, right? Or the more you can make it easy and simple and not required, just one person, the more likely that could get done, more streamlined. The other ideas we had early on where we could, print out the referral or have a written type of referral, and then we would batch fax it once a week. But as you can see, one or another system may or may not work very well, either for your clinic flow or for the WIC program in your area. So this is where that line of communication between you and your WIC liaison in your county office will really help figure out what's the system that might work for you guys. It was wonderful to have the flyers, and I hope one day we can get posters made, and then that will also increase the visibility. But so in terms of low touch, that would be more information. That would be more maybe the posters I mentioned. That might be more the providers or the nurses asking here and there. Even if they're not offering a referral or a more direct connection, they can promote the program in their language and in their workflow. And if you screen for food insecurity, which it sounds like many of you do already, could you add, do you want a referral to WIC in one of those questions? So depending on how you're doing your social needs screening, could you have that as an option for people to opt into or be asked about when they're looking at their other needs? All right, next slide. I'm not going to go greatly into this because I think Ms. Fisher is doing this later, but this is a WIC referral template that they have created as a way for providers to share information with the WIC program. One thing I did forget to mention in our EMR, when we faxed over through the EMR, the referral, it included the patient's name, date of birth, and the caregiver name and phone number so that WIC could reach out to them. It also included the child's recent measurements and hemoglobin measurement. So what this does, as those of you who are in WIC know, these are metrics that the WIC program likes to follow, but during COVID, and a lot of people were coming to care who were otherwise healthy, were missing some visits or less frequent visits. Us being able to share that information that we're getting with the WIC program, and they were doing more not in-person visits, it allowed them to keep tracking some of those numbers and have more information. So this just helped that two-way communication of information on those metrics. All right, next slide. So I thought we might just troubleshoot a little and maybe practice and talk through. So I'd love it if people went into the chat or either unmuted as we maybe talk through some clinical scenarios for your clinical setting. So the first one is Sylvia. She is checking in for her prenatal appointment. And she's been having some struggles with eating healthy, mainly from mostly a lack of access to healthy foods or the ability to shop for the healthier foods. And so during her visit, the medical assistant inquired if she was on WIC. And she said she'd not had time to enroll yet. She's just been so busy with work. But she asked for help in contacting them. So what kind of options do you think might work in your setting for this type of scenario? How could we help Sylvia connect to WIC? And I'm gonna need someone to help me with the chat, maybe.
And also feel free to come off of mute. This is very informal.
Yeah, we're very informal.
Hey, Chris, this is Lori in Knox. Are you wanting input from a WIC perspective, or are you waiting to see what the healthcare providers ask about?
I'm going to defer to Rosemary on that one.
I think feel free. Please
well, I will weigh in because this is the kind of stuff that I feel like we do an excellent job of helping with. I'm the WIC director in Knox County. And if you all had a woman who expressed this scenario to you, what you are welcome to do is using that handy dandy little referral form, send that over to our office. And we, in fact, will reach out to that mother, that woman, in literally under 24 hours and set her up with a remote visit to get her eligibility determined. And if we determine that she's eligible, her enrollment will also be offered to be a remote visit. So for a busy working woman, we don't ask that they spend any travel to get to us. We can help every time. So that's my 2 cents worth from Knox.
Great. Well, I appreciate that, Lori.
And we have 2 people. We've got Sam Brown in the chat has put, find out if her limitations are from her not reaching them or her not having a proper cell phone. If she has access to a cell phone, provide a contact list with local WIC providers. If not, call the local WIC office to schedule an appointment.
Yeah.
And then we have Jorge, if you'd like to come off mute and tell us what you think.
Yeah, the question is 2 questions. First, can we call directly as advocates? Can we call directly to the health departments of the WIC clinics to refer them?
My understanding that you could facilitate that if you have a relationship with your local WIC office. I think it's easier if you're a healthcare provider to develop that relationship first and then start figuring out the best way to clear, those names or that patient information. You can always offer the information to the patient herself, but then she also needs to call. Whereas if we can facilitate that connection, that would be ideal.
Okay, and the second one is like we mentioned at the beginning, like the language barrier. So most of the cases that we have sometimes, and that's why they don't want to go to there to fill the applications, is because sometimes they don't have, for example, Spanish speakers or interpreters or translators inside at that moment. So and probably that's why they use, oh, I don't want to do anymore, so I don't have time, and blah blah blah. So I was thinking, because we are just started as a Turk, we just started collaborating with the project. So, and I'm super excited, and we have yesterday a really good clinic, to pre-screening clinic last night. So that was amazing. But I was thinking, one of my projects is to connect with the agencies locally here and check where they when they have people available to translate to the customers, and then so we start getting relationships. The other thing is like I was talking with some moms this morning also, and that's why the problem also is like they don't have, or they don't want to make a time to go to their physicians to get the set up the appointment for the physician, and then the appointment for the WIC agency. So that's kind of like the troubleshooting that we are looking now. So, and that's why we was thinking it's better to connect and check when they have translators, So, and then we can set appointment for them.
Gotcha. Yeah. And I think that, you know, depending on the county you're in and their resources, you're going to have some, like let's say Davidson County has lots of Spanish speaking staff, but other counties might not. So you're right. Trying to figure out from your local office what either those times are or what's the best way to communicate. I know that when we sent our referrals electronically, we were able to put the patient language in there so that when they reached out, they knew that they would, you know, need a translator, let's say for an Arabic speaking family or a Spanish speaking family. So that was helpful in our communication. Does anyone from WIC want to comment on?
Yeah, this is Sarah. I'm from Knox County WIC, and Lauren's put the answer in the chat. So I'm just gonna half read, half explain. We use telephonic interpreting. In Knox County, I have 1 fluent nutrition educator and 2 fluent clerical staff. So full-time, most days I've got somebody here, but that doesn't mean that every clinic would always have somebody. But we are by law required to have interpreters available. So we all have contracts with telephonic interpreters. So anytime we're open, we can place a phone call. So the biggest question we've got is, what language do you speak? Because we'll have a telephonic interpreter in your language ready for you.
Great. All right.
Yes.
Okay,
I just want to add that, hey, this is Lisa. So statewide, we're required to have those services available to individuals who come into our local health clinics. So again, as Sarah mentioned, it's just identifying the language. And then from there, either we have a telephonic service or we may have an interpreter at the clinic. So all of our local WIC clinics will have some type of service available to accommodate anyone that comes into our clinics.
And this is Lori. One last comment. I want to circle back to what he mentioned about reaching out to the local office. I cannot underscore strongly enough how important having that relationship is, because WIC clinics are different from one region to another, from one county to another. And what sounds great that works for us may not even exist in another region. Reach out to your local office and set up a meeting. Ask your questions of them directly, because we want all people who are eligible to be on our program. And we're going to do what we can. And you won't know what's available unless you meet them and ask your questions. So go back to that as your starting place. I applaud you for recognizing that that's a thing you need to do.
Thank you so much, Lori. And in the interest of time, Rosemary, I think we should probably skip over the next case study and get to the last slide. Is that okay with you?
That is fine. I had a feeling we'd have a lot of discussion. So that's great.
A lot of questions. And Katie, we will get back to your question when we get to the next section. Take it away.
Sorry. So this is my last slide. And this was just kind of thinking about how this might look in your area. And some of the things we've already talked about contacting your local county office, having information about WIC program in your office, encourage patient participation in the program. The TJC is going to have more information and support even after this webinar on how providers can connect to their local WIC office or help patients connect. And then we also had WIC in our connection with our WIC office, had them do a little staff education for us as well. So that was very helpful. But I'm going to pass it off to our next speaker.
And we will come back to questions at the end. Next up, we have the pleasure of having Lisa Fisher, who is with Tennessee's State WIC, and she's going to talk a little bit about her perspective as someone on the other side of the process.
Yes, good afternoon, everyone. I am Lisa Fisher, the Nutrition Services Coordinator for the Tennessee WIC program. And I just want to let everyone know my primary responsibilities are to provide nutrition education opportunities to our WIC families, program training for our WIC staff, program oversight, and nutrition education material development. Okay, next slide. So here today, I just want to talk a little bit about our referral form that you all have seen that we're so proud of. And we did develop this referral form with input from our staff and our central office staff. This referral form can be found online, and it's can be accessed through tn.gov/WIC. Now, the purpose of this referral form, as you can see, and we've talked a little bit about it already, and it's basically to reduce the barriers of our participants coming into the WIC clinic and having to have measures taken. So if these things have already been done, it really helps the process flow. And of course, as someone mentioned, this offers as a communication between our healthcare provider and WIC staff. And we also can use this as an outreach tool. Okay. So I'm just going to jump into the referral form, give you an idea of how it looks. If you're able to go to our website while I'm on this call, that would be great. So again, if you go to tn.gov/WIC, you will see a box, a set of tabs on the screen. And if you go to the tab that says for healthcare providers, you will see a listing as you see on my screen here. And the first tab that you want to click is the one that says referral form. So if you have an opportunity, please go ahead and click on that referral form. Okay, we can go to the next one. Good, okay, we're there. So when you go, well, no, go back one. Okay, so when you're on this site here and you click the referral form, it's going to open it up for you to have a fillable form. And with that fillable form, of course, you want to click the download and you want to complete the form. Okay, we can go to the next one. So this just gives you an idea of kind of what the form looks like on the very top. And this is a very important piece. So on the top, it's asking you for the WIC clinic information. So if you have a patient that comes in and they're not really sure what clinic, but say they may know the county. So for example, they may say, oh, I live in Knoxville, or I go to Knox County Health Department, but I don't know the number. But you can click on that option right there where it says tn.gov/WIC -clinics. You can click there and it will give you a listing of the clinics. And by doing that, you can just type in Knoxville and it'll pull up the clinic that's in Knoxville. And you're able to go in and complete that information for that fillable blue fields that you see. Okay. So the other thing I want to tell you is on that field, it is very important to try to put as much information as you can. So of course you see the WIC clinic site, type in the county. If it has a telephone number, put the telephone number there. If it has a email, please put that. So all information that you can find from just clicking that search would be great. Okay, next slide. So you'll see that I completed one, and this is just the first half of that referral form. So you have all the information there. And again, this top portion needs to be completed. Okay, let's go to the next one. So the second section, this is so vital. And of course, a lot of individuals have already talked about this section. This is very important because in here, this is when you're going to give us that vital information that we need. So of course, we need the participant's name. We need the date of birth. We need patient phone number, primary language. And that's been the key thing that we've been talking about right now. So please put the language there. Also, medical information, anthropometrics, please, height, weight. If you have a hemoglobin, if that patient is, if it's something that we need for that particular individual, you will put that there. But for my example, this is actually a new baby, so we don't need a hemoglobin for a baby. Any other information that you would like for the WIC staff to know, you can put that there. So this one, no health concerns. However, the caregiver for this infant requested this WIC referral. So any information that you think is vital that will help the WIC clinic, please put that in this section. Okay, so next. So the third section, as I mentioned before, first two sections, very important. This one is even more important. And someone mentioned this earlier, and I believe it was Chris, it's about credibility. So if we know that that second section is completed and it's credible and it's done by, your team, great. So what we ask is that in this section that you please put your clinic name, that you put your telephone number, that you put your fax number, and also email if you have that. And lastly, we ask that you, the healthcare provider, sign off, or if you have a designated person, please advise that person to sign off. Okay, next slide, please. All right, so now you see this is a complete referral. This is all we're asking for. And by completing this information, this really helps our staff. And as I mentioned before, it helps with reducing the barriers for the participants having to come in or the applicants having to come in for those measures if they're already done. Next slide, please. Okay, so once this form is completed, I would advise you to save it. Save the form. Hopefully, if you have a file that you save your information for your clients, that you will please save it. Now, once you've saved it, you can send it over to the WIC office. It can either be emailed, it can be faxed, or it can be mailed. Or you can hand it to the participant and let them take it to the WIC office. But really, it's kind of your determination of how you would like this information transmitted. Next slide. So any questions? And I'm so glad to have some of our local agencies or local clinics on the line, so maybe they can, offer some additional things that maybe I may have left out.
Hey, this is Dr. Amos, and I'm just going to come off mute for a second to mention a couple things I dropped in the chat for folks. I'm the Deputy Commissioner for Population Health. I left the legislative report that we completed last year that goes into a lot of detail about the physical presence waivers. If you go in the chat, you can see some people referring to those and whether or not and how situations when you may or may not use those. Also in there, I put a link to a document that we have that has information about the WIC Shopper app. That's what I personally use in my clinic a lot. Is I actually printed off a bunch of those copies, cut out the QR code. So it's in the cabinet of every exam room. And I scan that, have the families pull it up on their phone, they download it. And then it's available in multiple languages, and it gets them to that local WIC clinic, at least for I like to send them in for the first visit if possible, but it lets them know who to call and how to get in touch. One thing, Lisa, I think that might be great would be, and this is something you can talk with the team with, is maybe to somehow link this form into that WIC Shopper app somehow. That would probably be a great way to continue that.
And yes, I totally agree. Yeah, because I think it will link them to the actual page, and they would have to kind of click around. But yes, it is there, and yes, you're so correct, Dr. Emerson. That is truly a good vital connection to be made. Thank you. Okay.
We have a couple of questions in the chat. Leitza asks, they're an ACA navigator. Majority of their clients are undocumented pregnant women and always ask about how to apply for WIC. When they call the number to make an appointment, there's a long wait time. Are they able to use the referral form, or is there another similar form? And someone else asked the same question about community health workers. So I guess the question is, are non-physicians able to use this form for referrals?
Yes.
Perfect. That's great. And just in the interest of time, I'm going to go ahead and move on. Thank you so much, Lisa.
Thank you.
And like I said, I'll share the slides. Here's her information. And next, we're going to hear from Sarah Griswold with Knox County. So we've talked to someone at the state level. Now we're going to talk to a local.
Well, good afternoon, everybody. So my goals for the presentation are just go a tiny bit more into the benefits of WIC, because I think we're awesome, and talk a little bit about us here, and maybe even mention that shopper app again that Dr. Amison put in the chat. If you go ahead to the next slide, this is just a quick reminder. We've already covered this. So this is who we are. I updated our numbers as of September. So Knox County is over 10,000 participants. We've seen a lot of growth over the last 3 years. So go ahead to next slide, and I'll read my notes here. So Chris gave a great overview to say who we are. So in Knox County, we have a team of 12 nutrition educators, and we build rapport with our clients and provide individualized counseling to help families set goals for healthy eating. We discuss typical feeding patterns, expected serving sizes, ways to introduce a wide variety of foods, and other nutrition concerns to set children up for a lifetime of healthy eating. And we recognize that pediatricians want to do this, and some of you do it very well. OBs can talk about food in pregnant women visits, but typically we get to spend a little bit more time with food and nutrition specifically. Y'all have a lot more to cover than just food. So our conversations can be more meaningfully tailored when we've got the current weight, length, and hemoglobin or hematocrit, so that those referral numbers, and when Dr. Hunter says that she's getting those referral numbers sent over through her process, it's all very exciting to see. We are equipped and trained to collect the measures here in our office, but we prefer the referral measures, as it ensures that the healthcare provider is the established medical home and that it decreases the duplication of effort on the family's part to make 2 different appointments to come in if we can just get those shared measures. Our food packages are tailored per federal guidelines and the family's preferences. So if you're hearing feedback from your patients that says they give me too much this or they give me that and I can't use it, you can encourage them to ask more questions of us. It's possible that we didn't explain fully what options there are. And if it's something we can't change for them, dairy raises a lot of questions and concerns because alternate milks are so much more popular now than they used to be. We have a whole bunch of milk and we can change it over to lactose free and we can change it over to soy milk, but more choices coming is a big future question for the USDA to look at, not us here. So our focus is on nutrition foods that are easily prepared and easily accepted by our population. So with referrals, because we refer out too, it is a federal requirement that we provide referrals to other social services and medical services. So we document each of our clients has a medical home or a primary care provider. We stress the importance of regular health checks and immunizations with every client. Knox County maintains an extensive referral list, and I linked it here on this slide. Our website, knoxcounty.org/WIC. There is a link to our referral list if you wanted to see what kind of resources we have for Knox County. Every county does generate their own, or every region, because some of our rural regions are in groups. So how exactly everybody provides referrals is their own deal too, but we are required to do it. So we collaborate with our local CHANT office, the Community Health Access and Navigation in Tennessee. Every local county has, county health department has access to the CHANT program, and they're available to do more intensive kind of referral work as well. Okay, next slide. So now that you're very familiar with the referral form and partnering with WIC, there's the Tennessee.gov website again. But I want to take this opportunity to talk a little bit more about what Dr. Amison said about the WIC Shopper app. It is an awesome new resource. Anybody and everybody can download the app. So you don't need a card to access some of the resources in the app. The food list, the booklet that we share that provides the exact foods that are available, the clinic locations, grocery store locations, some things are available to anybody. But sharing a card number is something that we can look that up so that we can actually see how this works. There's no privacy information that you're getting in the way of. So if you want to help someone look through their benefits, if you want to help, that app is incredibly powerful. It's becoming more powerful as the state works on it. So it's very exciting, and I can't say enough about the Shopper app. So we have tons of flyers in our office. If there are local providers around Knox County that want Shopper app flyers with that EBT on it, the QR code, with the QR code available, we have them, just reach out. We also have a trifold brochure very similar to what you saw for Davidson County. We do already have a few partners in our area who are distributing that to their clients and patients, and we're extremely thankful. But if there's anybody here that knows they want something from Knox County, please reach out. If you go on to the next slide, this is our contact information. I do want to say how impressed I am with Dr. Hunter's process. And I know Metro and Davidson County is also appreciative of her efforts. In Knox County, we accept referrals just about any way you want to send them. We have an email address, a fax machine. There is a quick reference guide that Chris will attach to the follow-up. So, and if you want to reach out to me, if you've got ideas for how to make this work through your electronic health record, I am ready to hear about it. I just wanted to mention real quickly, because I know the majority of the contact that I have with doctors in our area is about our formula and requesting formula. So we know it's complicated. We know there's a lot of specific details on that form, and we are going to get back to you about those specific details if it's not all completed. So if you're patient with us, we will happily be patient with you, because we are working through federally required details on how to request formula that's not our contract formula. I'm happy to come out and meet with people in our area, in our Knox County area. And I'm happy to be a better partner. So that's what we want, is to let us know what we need to do for you all. And my slide is just, what questions do y'all have for me?
Thank you so much, Sarah. I really appreciate you joining us today. This is a good perspective from a local county level. In the interest of time, I know that we have 1 minute left, so I'm gonna try to get through my remaining slides. But if anybody has questions, please put them in the chat. So just a few things. We have like I said at the start of this, we have a monthly working group that we call our WIC Champions group. We would love for you to join us. When you get these slides, there will be this link here that you can join us. We meet every second Thursday at 9 a.m. And it's a great opportunity to learn more about the project and how people can help increase participation. For those of you who are not living under a rock, you have probably seen the government shutdown issues and the continuing resolutions. It can be bad for WIC if we don't speak up. So for those of you who are able to do advocacy, we have a form letter written that you can apply your name to and send to your legislators. And then we also have a story collection tool here. And if you are someone who is on WIC or have been on WIC, you can give us your story about why the fruits and vegetable benefit, the CVB, is helpful, and that will assist in our advocacy as well. Here are some other ways you can help. Yes, absolutely. The flyer I shared earlier is linked here. Our legislation page is here as well. Here is a list of non-exhaustive list of WIC-related resources. Please feel free to use all of these and more. And lastly, here is our contact information. Anna Grace Breedlove and Dobson Ball are our WIC staff here, and Anna Grace does our referrals. If you need help reaching a specific county or office, feel free to reach out to her. And I've just been informed that the WIC Shopper app can be translated into different languages by changing the language in the settings feature of the app. So that's super helpful for people who maybe don't use English as their first language. With that being said, I know we're a little over time, so if anybody has any questions, feel free to ask them in the chat or come off of mute. And if you have to leave, I understand. But thank you so much to Dr. Hunter. Thank you so much to Lisa, and thank you so much to Sarah for being here today and sharing your expertise. We are super appreciative.
Thank you for having me.
Absolutely. Thanks everybody for being here. And if you have questions, feel free to email them to us afterwards. But thank you so much for coming and have a great day.
Bye. Thank you, everyone.